I think we'll get started now. I'd like to welcome everyone to our May webinar on living well during COVID-19, how to cope and manage your emotions. My name is Kathy Nickham. I'm the Education Director for the DPC Education Center. A couple of things before we get started. All of your lines are muted and will stay muted throughout the program. You may type questions in the chat box and we'll answer as many as we can at the end of the presentation. We also will post the recording and the slides in approximately a week on our website. Please also complete the brief feedback form that you'll see at the end of the program. Today we're going to explore the ways to cope and live each day to the fullest as we learn more about the emotional effects of the pandemic. We thank the American Psychological Association, APA, for their partnership with us to address the importance of mental health and what we can do during the pandemic. Jewel Edwards-Ashman, APA's Member Communications Manager, is going to introduce the speaker for our program today. Jewel?
Hi, thank you, Kathy. Hi, everyone. This is Jewel Edwards-Ashman, and again, like Kathy said, I'm with the APA. I'm also a kidney transplant recipient and presently a home dialysis patient doing peritoneal dialysis. And I've really enjoyed working with Kathy over the years to provide DPC members with resources and content to help address some of the questions you, your families, or caregivers may have about mental health and kidney disease. This year, I'm very happy to introduce our presenter for the annual webinar that we work with DPC on for Mental Health Month. Dr. Elizabeth Christofferson is a clinical psychologist who specializes in working with kidney disease patients and organ transplant recipients. Dr. Christofferson is the clinical director for psychology for the solid organ transplant teams in the Kidney Center at Children's Hospital Colorado and an assistant professor at the University of Colorado School of Medicine. Thank you so much for joining us today, and so I'll just let her take it away.
Great, thanks so much, Kathy and Jewel, and I'd like to welcome everyone today. I also want to thank DPC and APA for inviting me to speak and really for planning this webinar with attention to, a vitally important aspect of this pandemic, which is mental health and well-being in terms of coping with COVID-19, and just great that it's during Mental Health Month as well. Of course, thank you all who've called in today to participate in the webinar. So I want to start by reviewing the causes, signs, and symptoms of stress so you can really recognize these in yourself as well. We know there are many stressors already present for you all, and really COVID-19 adds stress in these domains listed here. Additionally, we know that having a chronic illness adds a significant component of stress that those without a chronic illness do not experience. For instance, dialysis patients are higher risk for infection, needing to go to the dialysis center 3 times per week. Patients who are an older age are in the high-risk category, and patients with transplants are immunocompromised, making them higher risk. Overall, there's concern for this higher risk of complication. On the one hand, some of you may feel like you've been preparing for this and have always lived in this sort of mode of heightened awareness regarding germs and illnesses. And for some of you, you've already at times practiced isolation and social distancing before this pandemic. On the other hand, you may be even more aware and concerned about the risks of COVID-19 because of this. So let's talk about some of the contributing domains and symptoms we may observe. At the most basic level, people may be experiencing physical and health safety concerns regarding really how to keep themselves healthy, how to continue their medical treatment, the importance of, continuing to go to those appointments while also practicing social distancing. In terms of emotional and mental health, we may see increased irritability, mood concerns, anxiety and sleep difficulties, lower frustration tolerance, especially in children. And in terms of family life, we're experiencing more togetherness with fewer breaks, creating increased tension and difficulties balancing needs of all family members. In terms of our work and school life, people may be experiencing stress related to job loss, furloughs, salary cuts, the adjustment to remote work or learning or new ways of working, and really sadness over cancellation of certain traditions, events at school and work. And then socially, people may have additional screen time during this pandemic. People are really missing their friends and family, and we know there are overall disruptions in relationships. So we really need to be aware of the anxiety and what we can also consider trauma that are associated with a global pandemic of this scale. We know there are unprecedented changes that it has caused in our social behaviors, our day-to-day activities. We know there are devastating job losses, isolation, increased virtual interaction and time at home, and these can cause conflict and tension. The pandemic can also be conceptualized as creating global grief. You may be experiencing grief related to cancellations, the loss of many different aspects of your life, fear for your health, fear for loved ones. And you might experience these stages of grief that I have listed here: denial, anger, bargaining, sadness, acceptance. We know that acceptance is definitely one of the goals, and we can also think of the final stage as acceptance and hope or meaning. Acceptance is really where the power lies. We find control in acceptance rather than in the other stages. This can sometimes be conceptualized as anticipatory grief as well. The losses that we think about are sometimes concrete, but sometimes abstract and vague or hypothetical. So the cancellation of an event that you haven't ever experienced. This is actually anxiety coming into play. It's anxiety about future uncertainty. What we want to do is find more balance in what we're thinking about. Notice our thoughts and utilize adaptive coping thoughts and acceptance. This is where mindfulness comes in, which we'll discuss throughout the talk today as well. Common stress symptoms that may occur during this pandemic include concern about protecting yourself from COVID-19 and ongoing mood and exhaustion because of this. You may experience sleep and appetite changes. Some people turn to increased use of substances for coping, which we know is not helpful in the long term. Additionally, we know that previous mental and physical health conditions may be exacerbated by stress of the pandemic, which can create a vicious cycle. Again, identifying symptoms of stress really is the first step here. Indeed, a recent poll found that 56% of people reported worry and stress related to the pandemic with at least one accompanying negative symptom. And the Harris poll through the American Psychological Association found that the average reported stress level has risen in the United States, marking the first significant increase in stress levels since 2007. The average stress of U.S. adults now is at a 5.9 out of a 10-point scale, with 10 meaning the most stress. And as you can see in 2019, it was a point lower at 4.9. Parents of children under 18 actually reported an average stress level of 6.7 in the past month. And then this diagram on the right here shows how the first wave of COVID-19 includes the immediate morbidity and mortality, with the second and third waves impacting overall hospital resources and chronic care conditions. And then the fourth wave actually being the mental health effects, which we're discussing today. We really want to get ahead of this fourth wave, which is why it's so vital that we talk about it that we aren't ashamed of asking for mental health support, and really recognize its importance just as much as physical health problems. And it's why I want to commend everyone for being here today, listening, and hopefully learning how to recognize difficulties within yourself and others and learn coping strategies. So research has already been conducted during COVID-19 among patients with chronic illnesses. And this research shows that people who have chronic illnesses and are high risk do a great job overall of self-quarantining and reducing their exposure to COVID-19. But they struggle more with asking others for help. So for example, asking a friend or neighbor to go grocery shopping for them. They experience anxiety due to many reasons, which we'll be discussing. And they overall feel supported by others and by their employers. And a consistent theme is they really want more information from their healthcare teams. And they think that local and state governments may be managing the outbreak better than the federal government. So we mentioned the many reasons for anxiety among patients with chronic illnesses. This graphic depicts some of the reasons with real quotes from people who have chronic illnesses and are in the high-risk category, and were asked, what they're worrying about at this time. Patients are concerned about the type of treatment they would receive if they got COVID-19. They have concerns about exposure to COVID-19 at work if they are going into work. They feel like they may not be able to prepare. They might feel isolated from others. They have concerns that others will get sick and not be able to help them. People might be worrying about lack of medication or supplies needed for their illnesses. People may feel like they need to put others, such as their children, first. The lack of testing has been a concern. People who are in the high-risk category often feel uncertain about their level of risk and about losing control of their health. I know a common theme that I've heard from patients is frustration with others not following social distancing guidelines. Everyone's also worried about financial and societal issues, news coverage, government response, and just overall uncertainty of the future of the pandemic and the world. So this quote in the top left-hand corner that says, "Just when will this end?" I think we're all thinking about that. So I want to turn to management strategies for all of this anxiety and concern. As we know, the first step is recognizing the signs and symptoms of anxiety that I just reviewed. And the next step is management and interventions or treatment. We know that some anxiety can actually be adaptive, especially for people with chronic illnesses. It's probably a good thing to have a healthy fear of COVID-19, and this can help keep us safe. However, there's really a balance, and when anxiety spirals out of control, it may exacerbate physical health and mental health symptoms. Anxiety can even cause pain, headaches, somatic symptoms. This is because anxiety activates our fight or flight response, our sympathetic nervous system. This system was built into our brain to be adaptive and to protect us from danger. But when it's overly active, it can be harmful, especially if it's out of proportion to the threat or continues to be present in a really chronic manner that doesn't subside. So we want to work on helping to turn down or turn off this sort of fire alarm of anxiety. So first, let's discuss some of the basic tips that'll really help you feel more in control and reduce anxiety by ensuring that you're following precautions and really have what you need to be safe. Of course, you want to make sure to continue your treatments, including dialysis, any medications that you're taking. And I know everyone's already been kind of living through this for a few months, and hopefully has found ways to do these things. You can always contact your dialysis center or medical team if you are sick and wondering what you should do in terms of your treatment. Keep enough food on hand to follow whatever diet you're on, and also to follow an emergency diet plan. So there is this 3-day emergency diet plan online, which could be followed if necessary if you, for some reason, couldn't obtain food in a quick manner. Also maintain any other diet and food restrictions you have. Follow public health guidance, so social distancing guidelines, being 6 feet apart from others when you're with people who live outside your home or when you're outside of your home. Talk to your healthcare team, stay in contact with them, and really try to continue to ask them your great questions. Stay home when you can, follow any orders in your area, avoid going to crowded spaces where you'll be in close contact with others. Condense your grocery and errand trips out in public. So make sure you have enough on hand and can reduce how many times you need to go out and get those things. If you can get a 90-day supply or longer supply of medication in some insurance cases. You can ask about online ordering and delivery of medications, and you can look into other delivery services as well to reduce trips out in public. If you are leaving your home, make sure to keep that 6 feet of distance and avoid peak hours when you're going out to stores or places in the public. A lot of stores have kind of high risk or hours of operation where you can shop or be present in those businesses. It's great to utilize those times. Avoid touching your face. This is how we know germs get into your body. And avoid touching high traffic surfaces in public places. Use your elbow or tissue or sleeve to touch them if you need to. Wear your cloth face covering or mask in public, especially when it's hard to maintain that distance. Of course, we know washing your hands well is important after being in public, using soap and water, and using hand sanitizer when you don't have access to soap and water. And make sure to regularly clean and disinfect at home, and make sure others who live in your house do this as well. We don't know how long we'll be wearing masks in public, but what we can do is control our own behavior and how we respond by following these guidelines. So like we talked about, continuing your regular treatment plan, your medications, and your appointments with the medical team. You can try to utilize telehealth when possible and discuss your concerns with the teams regarding any appointments. It's been great that a lot of providers are now offering telehealth when they're able to, and even have different protocols for going to obtain labs and ways that hospitals are trying to reduce how much contact you have when you do go in. So continue to obtain your dialysis or other necessary medical tests, and still seek urgent care if you need it. You can always call ahead and ask how you should go about seeking that urgent care. Importantly, manage stress, eat healthy, and exercise. So managing stress is really one aspect that sometimes sounds easier than it is, and we're now going to turn our attention to that piece. This is another aspect of the pandemic that we can control, our response to stress in terms of coping. I'd like to review this model presented by Russ Harris. He's the author of The Happiness Trap, and this is called Face COVID. It's an acronym with these steps outlined below that I'm going to review. So first step, focus on what's in your control. So you can't control what happens in the future, coronavirus, the economy, what other people do, and even your thoughts and feelings. We know that fear and anxiety are inevitable in this case. But what you can control are your actions and the here and now and what you're doing. So the next step, acknowledge your thoughts and feelings. Notice what's going on and what you're feeling and thinking, such as I'm having thoughts about getting sick, or I'm having feelings of loneliness. This is kind of what we talked about in terms of recognizing and identifying those signs and symptoms of stress. Then you're going to come back into your body, connect with your body. So for example, slowly press your feet into the floor. Be really mindful of just what is exactly going on right now and what you're feeling in your body. Stretch your arms slowly, do deep breathing slowly. We'll review some more of these strategies in a bit. E is for engaging in what you're doing. So this means a focus on the here and now as well. Refocus your attention on the activity at hand. For example, you can notice 5 things that you can see, 5 things you can hear, 5 things you can touch, taste, and smell. That kind of exercise can really help you focus on the here and now. Give your full attention to exactly what you're doing. C is for committed action. This means implementing effective action that's guided by your core values while also following the guidelines of the crisis. So ask yourself, what can I do right now that improves life for myself, those in my community, or my friends and family? O means opening up. So make room for those difficult feelings and be kind to yourself. Acknowledge the fear, anxiety, sadness, loneliness that we're all feeling. We can't stop these feelings, but we can make room for them and normalize them. Treat yourself kindly in these moments. What can you say to yourself, and what kinds of things can you do for yourself when you're feeling this way? So values refer to those core values that guide your committed action from the C step above. What do you want to stand for in this crisis? What sort of person do you want to be? Examples of these values include love, respect, patience, caring, courage, compassion. Sprinkle your values into your day. Ensure that they guide your actions. Identify resources. So really gather your resources for help, assistance, support, and advice. We will discuss these resources such as mental health and emergency hotlines as well. Finally, disinfect and distance. So disinfect your things and your home and practice physical distancing like we've talked about. Remind yourself what you're already doing to remain healthy and how you already have a lot of skills to maintain your health and prevent infection. By living with a chronic illness, you already know how to do a lot of this. So another way to reduce anxiety is to monitor your media and screen time. News can be both important to stay informed and also a source of stress and anxiety. If it is causing you stress, limit your news and media consumption and your screen time as well. You can limit your news to 30 minutes or less per day, turn off any news alerts on your devices, and make sure you're utilizing trustworthy news and medical sources. Monitor your screen time. As we know, it is likely increased currently. Some activities may make you feel good and connected to others, and some may cause anxiety. Between Zoom, video calls with friends and family, virtual learning or work meetings, social media, and news, which make you feel good? Some of these activities may be necessary at this time, but you can certainly set boundaries around them for those that cause you anxiety. Take breaks and notice what is helpful for you. This is a really important time to establish and maintain a daily routine, despite our routines being so disrupted. And at this point, I know a lot of people have kind of found their rhythm in this pandemic, and yet we know that the pandemic is ever changing and new news keeps coming out and new guidelines keep coming out, and we have to continue to adapt. So what you can do is maintain a consistent sleep-wake cycle, get exposure to daylight in the morning, and make sure you're exercising and utilizing overall stress management. We know this daily routine can increase our immunity and regulate our circadian rhythms. Try to get 8 hours of sleep a night. Get up at the same time every day, even on weekends. You might have a little bit of leeway on weekends with an hour or less of change, but that should be about it. Discontinue those electronics at least an hour before bed, as we know that the blue light from them can disrupt sleep. Make sure your bedroom promotes sleep in terms of being quiet, dark, cool, and relaxing. Monitor caffeine, avoid too much alcohol, and definitely avoid large meals right before bed as well. We know healthy eating and staying hydrated is important for sleep too. Utilize your relaxation tools that we'll continue to talk about and physical exercise. Even just getting dressed during the day is a cue for you that it's time to start the day and can promote this routine. We know that stress and anxiety create tension both in the body and the mind. When we're stressed, we tend to have tense muscles. When we're in that fight or flight mode, we tend to tense up. Utilize relaxation exercises to help reduce this tension in the body and the mind. So deep breathing, guided imagery, and progressive muscle relaxation are mindfulness-based stress reduction techniques. These are evidence-based and scientifically shown to reduce stress, anxiety, and depression symptoms. Deep breathing or diaphragmatic breathing is one of the most basic techniques that you can do anytime and anywhere. Deep breathing from the diaphragm rather than shallow breathing from the chest is a way to relax and reduce anxiety by avoiding the fight or flight response, really turning down that anxiety fire alarm that we spoke of. You may even be getting reminders from your smartwatches to engage in deep breathing. And you might be ignoring them now, but I hope that after this webinar that maybe you think about engaging in them. Guided imagery is another relaxation technique, and it utilizes a recording or a guide like a therapist or even your own imagination to envision a relaxing scene like a beautiful waterfall or an island with calm ocean waves. You can access recordings and videos for this through YouTube and various apps that guide you through these relaxing scenes. Progressive muscle relaxation is a method that involves tensing and relaxing all the major muscle groups of your body, from your head to your feet. This helps release physical tension more effectively and also reduces emotional tension or stress. And you might feel like some of these feel strange to you or even a little corny or cheesy, but I really encourage you to try these practices if you haven't yet. This is the perfect time to do it. We all could benefit from these during the pandemic, and I know I've been trying to use them a lot more in my own life as well, and with my patients who have really found that even if they were a little skeptical before, they've been able to kind of be more open to it at this time. Many apps that help with these techniques are currently free as well. You can also do simple mindfulness exercises, so like taking a walk, exercising. Other forms of relaxation and self-care could be For some people, watching a movie, cooking. For some, cleaning is even soothing. Doing arts and crafts, other soothing activities that help you relax. And you can also just take advantage of your alone time for a few minutes to refocus and calm yourself. So despite gyms being closed or maybe not somewhere that you want to be frequenting right now, there are many ways to continue to engage in exercise, either indoors at home or outside if practiced in a safe, socially distanced manner. We know that people who have been exercising during this pandemic actually have reported that they have less stress and anxiety and depression symptoms than those who have not been able to engage in exercise. There are free apps with trainer-led workouts listed here. You can bike, run, dance and sing, do yoga, and also take breaks between meetings or sitting times. Our bodies really need these bio breaks. It can be easy to be just on your computer at, doing your work or engaging with news or various media for long periods of time. And it really is good to get up every hour. Keeping our hands busy with tasks can actually reduce anxiety too. This is through distraction. We know this helps with behavioral activation and active coping. So some activities that are soothing to some people could be knitting, sewing, cooking, fixing things, cooking, like chopping, drawing and painting, art making, doing puzzles, painting your nails. A lot of people like to utilize writing lists to decrease stress or journaling. So let's discuss being a parent during a global pandemic. As a pediatric psychologist, I know this pandemic has created great difficulties for parents. You really all are superheroes. And it's also created difficulties for children as well. You all may have heard of the analogy about the oxygen mask. So make sure to put on your oxygen mask first before you help others. And this applies here as well. It can be difficult for parents to implement this though. But we know you can't take care of your children and family without taking care of yourself. So practice compassion within your parenting. It's great if you can utilize a schedule to keep people in the family somewhat on track. And also be patient when this isn't always the case or when the schedule is totally thrown out the window. It can just be a very loose guide. Practice these coping strategies such as exercise and mindfulness or relaxation together. Everyone can benefit from these and use these. Play together, be creative, and try to enjoy some activities together at home. Also make time for individual time and space. We know some people are more extroverted or introverted, and everyone can benefit from some quiet time as well. And here I've listed a great resource to talk to kids in a developmentally appropriate manner. There are really tons of online resources like this. American Psychological Association has a lot of great resources and books for children as well. This one listed here is interactive and meant to be completed with your child. It can be accessed on this website. Continue to connect with your family and friends virtually. Keep in mind that even virtual social connections like Zoom meetings can feel tiring at times, and don't judge yourself for this. But be mindful of whether you're isolating or withdrawing socially and not making time for those connections. Utilize different forms of technology or use old methods of communication, whether you're doing video calls, texting, phone calls, writing letters, or physically distanced outdoor social connection. People have figured out ways to play games online together, watch movies online together, and do exercise together through their screens. Make sure you have a plan for your health in terms of how you want to handle situations that may arise moving forward, especially as businesses begin opening up and as people start getting together more. This may include creating a script for if someone asks you to do something you're uncomfortable with, or how to discuss your situation with your employer or manager. As people begin to get together and frequent businesses more, decide what your boundaries are and what feels safe and comfortable to you. I want to highlight a few additional tools that are really rooted in positive psychology. So positive psychology refers to the presence of positive psychological resources. For example, having positive affect like smiling, having life satisfaction, and aiming to have overall happiness. We can actually work to increase positive psychological resources. Some of the ways to do this: the 3 Good Things app. So 3 Good Things is a practice that also has scientific evidence. So every day for 7 days, you write down or record in the app 3 good things that happened that day and your role in bringing them about. This has been shown to increase happiness and decrease depression symptoms and has an impact on you even after that first week of completing the exercise. Another strategy is doing random acts of kindness. This actually promotes well-being in the person doing the act of kindness even more than the receiver of the act of kindness. You can practice giving back to your community and being a helper, which promotes well-being in yourself. The goal here is really to define your core values and embrace them within your work, relationships, and leisure time. The best is when these values overlap across these domains. This is really protective against burnout. Finally, we know resilience is like a muscle. It is not fixed. It can grow stronger over time. So we can all grow in our knowledge about ourselves and each other and really try to learn from this time. Please know that seeking help is not a sign of weakness, that everyone likely could benefit from a therapist at any point, but especially at this time. And that especially if you exhibit any of these signs and symptoms, it may be even more helpful and important to seek professional help when our anxiety causes impairment in daily life, such as sleep difficulties, worries that are all-consuming or difficult to stop, an inability to disconnect from news about coronavirus, feeling like you don't enjoy activities you used to enjoy, sadness or crying that lasts for more than a few days at a time, or extreme isolation from any of your connections, it may be time to get help. There are so many resources widely available right now. So your medical center or dialysis center has social workers who are skilled and trained in mental health difficulties and the stress of chronic illness. And psychologists are often present at medical centers as well. Utilize these resources. You can also ask for resources for a local therapist or look on the American Psychological Association website for providers in your area. If you have Medicare, you also have access to mental health resources through Medicare. And many insurers are covering not just mental health resources, but even telehealth mental health resources. Medicare is definitely one that's covering these at this time. Many providers are conducting telehealth currently, and this really makes mental health support even more accessible. You can do it from the privacy of your own home. You don't have to go out, and it's just as good to be on screen with a therapist. It may change things a little bit and feel a little bit from an in-person, in-office connection, but we know that telehealth works really well for therapy. There are also crisis chat and text lines. The National Alliance on Mental Illness, the American Psychological Association, and the CDC have many, many resources and tips on coping with mental health as well through their websites. And I encourage you to visit these when you're feeling like you need some refreshers and reminders of some of these tips. So these are just 3 take-home messages from today. Make sure to practice awareness and mindfulness of yourself and others around you. Connect to what and who you value in terms of people and activities, and practice appreciation and gratitude, as we know these boost mood and mental health. And I'd now like to make this a little bit more interactive by having us practice a relaxation exercise together. This is one of the most basic mindfulness exercises and easily accessible for a beginner. This practice is focused on one of our most basic activities of the human body, the breath. So deep breathing or diaphragmatic breathing focuses attention on your breath, the inhale and the exhale. And you can do this while standing, sitting, or lying down in a comfortable position. Again, for anyone who hasn't tried these types of exercises and who might be skeptical about their ability to focus on these exercises, I encourage you to be open to trying this now, even if you haven't before. Before we begin, think about how your body and your mind feel now. Stressed, tense, distracted? We'll check in after this activity as well. This is from one of the apps I referenced, Headspace, but all of the apps I listed have similar activities as this, and you can find them on YouTube as well.
Once you're sitting comfortably, just taking a big deep breath, breathing in through the nose and out through the mouth. As you breathe in, focusing on the lungs filling with air. As you exhale, just gently closing the eyes. As you feel the weight of the body press down. And as you pause, just noticing where in the body you feel the breath right now. So we're not going to breathe in any special way. Instead, we're going to listen or notice the natural rhythm of breathing, noticing whether it's fast or slow, whether the breaths are short or long. If you can't feel any movement in the body at all, just gently placing your hand on your stomach. And just resting the mind on that rising and falling sensation. So nothing else to do, nothing else to think about. Allowing thoughts to come and go. And just resting the mind on the breath. And when you're ready, you can just gently open the eyes again.
Okay, so I want you to notice how you feel after that exercise. Did your tension, anxiety, or stress reduce even just a little bit? This was just a short exercise of deep breathing mindfulness, but can be so beneficial even just for a few minutes. We know that diaphragmatic breathing increases your resilience to stress, anxiety, and anger. Practicing this deep and slow breathing, or just breathing naturally, observing your breath. You can practice this in other relaxation techniques such as guided imagery, progressive muscle relaxation, on a regular frequency whenever you feel like it. These exercises can also be especially helpful to use when you're feeling really stressed or anxious. The more you practice them, the better you're able to employ these techniques when you're stressed. So it's good to practice them when you're not stressed as well. When your mind wanders from these exercises, which it will, with other thoughts or sensations in your body, that's okay. Just notice your mind wandering and gently bring your attention back to your breath. Hopefully you feel more relaxed and less stressed after this exercise. And I hope you've learned some tools and tips for coping with and regulating your emotions related to COVID-19 today. I'd really like to thank you for your time today, for joining us, and for the opportunity to present on this important topic. And I'll now open things up for some questions.
Thank you so much, Elizabeth, for sharing that activity with us and all of the tips, suggestions, and ways to understand what's going on during this time. One of the things I found is that even doing just such a short mindfulness meditation, it gives more energy. And I think that reflects how anxiety and stress can really zap us of energy. So
absolutely, it's so true. It's incredible how just a 2-minute exercise can really be so helpful.
Right. Thank you. We do have a question in the chat box where someone received an email from a patient who their spouse had lost their job, and so they've been forced to live in a one-room extended stay hotel, and they're not able to separate in other rooms, so thus they're always together. What advice do you have for them?
Yeah, that is really challenging, and can imagine just the unbelievable stress that they're going through in terms of financial stress and being, relocated to stay in a extended stay hotel. And I know people are struggling with financial and kind of logistic aspects and barriers due to this pandemic. It's a great time to utilize your resources in terms of, your social work support. If they have any additional resources or ideas or applications to public service or foundations that can help you with any financial resources at this time. There are some agencies that can help with situations like this. Of course, unemployment would be another thing to think about and pursue, although I know it's certainly challenging right now given the high rates to even get through to these offices. I think that would be a time to really ask for help, and I know asking for help can be very challenging for a lot of people, and yet this is a time that we need to put aside our pride and know that accepting help is important. So utilizing family and friends in your networks to ask for any help and support. In terms of kind of being, in such close proximity in a small extended stay hotel, which I know a lot of people are feeling in some ways, just being around family so much more right now, but being in such a restrictive environment with your spouse. I think trying to, figure out if there are any ways you can get outside in a safe way, even just for some outdoor walks or physical activity where you're away from others. And that can be time where you're not in the same space, right? That's one way to take a break. Even things like putting on headphones and doing activities separately can help create some space and breaks. Just continuing to practice whatever self-care strategies that people have when they're, needing to be with family a lot more or in a small space together. Some of our self-care activities, of course, are different these days, but finding any that are possible within that space or safely outside of it. And of course, keeping connections through whatever phone or virtual connection that are possible, like we discussed, so that your only social connection is not your spouse or your family, that you have connections to other friends and family, even if they're virtual. It's still so important, and we know that social support is so crucial to our well-being.
Thank you for that. That's a lot of good information for that couple and that family, and certainly one of your comments about talking with the staff at their facility, their social workers should, as a good person to start with, and you've given lots of good ideas of how you can be together and yet have your space. So thank you for that. We have another question that said, what about the importance of laughter?
Yeah, that is
to comment on that.
Yeah, that's so important, and I think laughter falls into those kind of positive psychology aspects that we spoke about. So positive affect, smiling, laughing, those are medicine. We know that, being able to laugh and find joy even in difficult times is a positive psychological resource that reduces anxiety and depression and stress. And finding ways to still have laughter and joy in your life, even during this global pandemic, is so important. So that might be watching funny movies, talking with friends, and not just talking about the pandemic, right? Talking about other things or telling funny stories or jokes, talking about shows or movies you watched, watching those together. That all is healing and can really take our mind off of what's going on. Some of that distraction is healthy and really necessary at this time. So that's a really great question.
Yeah, and those are some good suggestions. I think you're right in that it's so easy when talking to somebody that the only thing we focus on is the pandemic. And
yep.
There is great relief that can come from sharing something funny that's happened. Or, as you said, there are lots of funny movies that are out there on all the different streaming. So some great
Absolutely.
ideas. Thank you. We have another question here that's asking for, can you share some other specific mental health strategies for caretakers?
And caretakers, do we mean those taking care of people with chronic illness?
And it doesn't say, so maybe
Okay.
you could address caretakers as the family members
Yep.
and caretakers as staff? A
Yeah.
little bit of both?
Yeah, and definitely, family members of patients with chronic illness, whether they're adults or children, are under incredible stress at this time as well, because they know they're feeling stressed about, whether they're the ones doing the errands or groceries, they're worried about bringing something into the home, and they're really worried about keeping their family members safe at this time. And sometimes that can be even more stressful than being the one yourself who's worrying about yourself. So I want to commend all those caretakers who are in that role. I think really, all the tips from today apply, with special importance to, of course, utilizing all your guidelines in terms of prevention. If you are going out, and what can you do to reduce exposure in your home. But I think, making sure that while you're a caretaker and while you're helping someone with a chronic illness, and knowing that they're stressed and you're stressed, that you also need to make sure to take care of yourself. So blocking out time where okay, I know I have these cares for my spouse or family member or child who has a chronic illness, and knowing that those are times that you want to make sure you're present and available and able to do those things, and then blocking out separate times where you can really practice some of these strategies we talked about today for promoting your own well-being. So it might be that it's helpful if you're feeling especially stressed right now or worried about, bringing in COVID-19 to your house, or just feeling stress of job changes or whatever else is going on in your world, that grounding yourself before or after caring for someone can be really helpful, using some of these relaxation exercises, making sure you connect with those friends and family, and talk to them about, what you're doing and what you're stressed about, and also how they're doing, and, other things, like we mentioned, not related to COVID-19. I think, carving out that time for yourself, while challenging, is really important. And then giving yourself a break, like I said, within the parenting section, having compassion, knowing that, if you're caring for a child with a chronic illness, that, maybe they have more screen time right now, and that's okay. And that we're all just trying to kind of figure things out right now. And so if things don't always feel as smooth or organized or as in control, that's normal, and that's okay, and that we all need to have some compassion with ourselves.
Excellent points. One last question here.
Mm-hmm.
It's about, dialysis patients. We know that they have stress. But, what about their family members who are also going through more stress at this period of time? Do you have any suggestions on ways that the dialysis patients can be supportive or help ease some of the stress of their family members?
Yeah, I think that's a great point, and we know that family members are going to have their own stressors right now, due to all the things we talked about in the beginning of this talk that could be going on in their lives, and that can then exacerbate, a dialysis patient's stress as well, and they might not know exactly how to be there for them. So I think focusing on really the tips of, how can you provide support while also caring for yourself? How can you notice within your family and friends, it seems like my partner's struggling or my child's struggling. Maybe they're exhibiting more irritability or they've told me they're not sleeping, or, you know, they are really having a lot of worries, and sorting out for dialysis patients, okay, what can I actually do, and where is the line where, like, it seems like they need some professional help, right? And so being a sounding board and talking to them is very important and helpful. And there might be times where getting a professional is really warranted, and that could be, you know, for the dialysis patient to have a professional sounding board, but really to make sure their family members who may have many worries of their own also have that. I also wanted to mention, in terms of stress for, you know, medical workers and medical caregivers, or any really frontline workers, essential workers in this time, there are so many resources for all of you as well, on all those websites that I mentioned: American Psychological Association, CDC, National Mental Health Alliance. There are a lot of great additional tips for example, medical workers, in terms of the heightened anxiety that they may be feeling being exposed to COVID-19. But again, really the same basic strategies apply in terms of recognizing, identifying signs of stress, and normalizing those signs within yourself, knowing that there are a lot of strategies we can do to help our stress, and that we should try to focus on practicing those strategies.
Thank you so much. The whole thing is communication again. We are out of time, so we are going to need to close. I wonder, we have one more question here that I don't know that if you can answer it in like 2 sentences. But we have someone who's, excuse me, who was asking how to support dialysis patients who are COVID-19 positive, and they accuse the center of being the source of getting it. Do you have one thought, a takeaway thought that they could have on that?
I know that's such a stressful topic right now, and you know, there are a lot of concerns about medical centers and other businesses that you know, we don't know where someone's getting COVID-19, but that it could be potentially some of these places, and yet we know that, you know, that may be a risk. And so, you know, trying to support that patient, be there for them, talk with them, validate their concerns, and really probably referring them to some patient relations at the hospital is always helpful, so that they can kind of be that sounding board, and trying to recognize that everyone is at a heightened stress and worry around where they might get sick right now. And so we want to try to reduce that, and also reassure that centers are taking such excellent precautions right now to be extremely safe.
Okay. Yes, thank you so much for that suggestion, and certainly the social workers, again, can also be helpful for that. You've shared lots of ideas. I so appreciate it. I think we have a lot of positive comments in the chat box. The attendees also appreciated it. I encourage everyone who's still on the line, please complete the feedback form, and please join us next month as we talk about bone mineral disease. And thank you again, Elizabeth. Thank you, APA, for partnering with this program. It has been great. Thank you again.
Thank you so much for having me.
Thank you.
All right. Thank you, everyone, and hopefully we'll see you next month. Bye.